For healthcare professionals, dialogue around patients' needs is essential for optimal patient care. In addition, GPs can learn from their consultant peers and use this for their ongoing education. My name is Dr Michelle Durham. I am a GP in London and am also a clinical lead for the NHS e-Referral service. I'm going to show you how quick and easy it is to use advice and guidance in the NHS e-Referral service. Jane Gregory is a 68-year-old patient of mine who came to see me a couple of days ago complaining of joint pain. The pain affects her left hip and her right knee. It also affects her right wrist. She is obese and she's recently become a grandmother. She is really worried that she might have rheumatoid arthritis because her mother suffered with rheumatoid arthritis. I've conducted blood tests and have found her to have a mildly raised CRP and a positive anti-nuclear antibody. I'm not sure what to make of these results, and I don't know whether they indicate inflammatory arthritis or not. I would therefore like to seek advice and guidance from a consultant rheumatologist. Using the web-based version of the e-Referral advice and guidance service, I would open the service using the hyperlink from my GP software system or by entering the web address. I would then select the Patient tab and enter the patient's NHS number, followed by pressing the Refer Advice button. And on the Service Search Criteria page, I have selected Advice as the request type and Routine as the priority. For the specialty, I have selected Rheumatology, and for the clinic type, Inflammatory Arthritis. I am then going to press Search to bring up the advice services for inflammatory arthritis in rheumatology. 3 results have been returned. I am selecting Castleton Hospital for this advice request, and I am checking that it's an appropriate service. I am then going to write my request for the advice in the dialog box. I am now adding all her recent blood results via an attachment from her clinical record. Having finished my advice request, I click Send Request and then OK. I have finished my morning surgery and I am checking my work lists in the e-Referral service website. I can see that my advice and guidance request that I sent 2 days earlier has now been returned. By clicking the UBRN number, I can open the advice dialog. Looking at the advice the consultant has given me, it is very clear what I should do next with this lady. I have also been advised on the appropriateness of my routine testing, and it is clear that I am overusing the ANA test. The advice the consultant has given me is to refer this lady for physiotherapy, as there is no evidence that she has an inflammatory arthritis. I will now produce a PDF of the advice and guidance dialogue so that I can upload it into this lady's clinical records. In my area, the local physiotherapy services are available on the NHS e-Referral service. Therefore, in this case, I can simply press the Refer Now button. This will take me into the service selection screen and allow me to progress the referral in the usual way. The advice and guidance dialogue, along with any additional information I wish to add, will be attached to the patient's clinical information for the physiotherapist to see. Were I in an area where I could not refer the patient for physiotherapy using the e-Referral service, I would end the conversation, concluding this episode of Advice and Guidance. So, I've improved my knowledge on immunology blood results, and I have also learnt what to look for in inflammatory arthritis. I'm reassured that this case is being managed correctly, and I've avoided an unnecessary referral to rheumatology which could have delayed the physiotherapy this lady needs. The NHS e-Referral advice and guidance service offers two-way dialogue between consultants and GPs. It's free to use, it's auditable, and a safe and secure method of communication.